Surgical prehabilitation has become a widely discussed topic in modern healthcare, especially as more patients and clinicians seek ways to improve recovery after surgery. Yet, despite its growing popularity, there has been no universally accepted definition for what surgical prehabilitation actually is. This lack of consensus has led to confusion in both research and clinical practice, making it difficult to compare studies or standardize care. Without a clear definition, interventions labeled as prehabilitation can vary greatly, from exercise programs to nutritional support or psychological counseling. This variability makes it challenging to pool data and draw strong conclusions about what truly works. Recognizing this gap, a team of international researchers set out to review existing studies and propose a common definition, aiming to bring clarity and consistency to the field. To address the lack of a standard definition, researchers conducted a comprehensive scoping review. They searched 6 major medical databases for randomized controlled trials that used the term prehabilitation and included adults undergoing elective surgery. The studies had to feature interventions lasting at least 7 days, focusing on exercise, nutrition, psychological support, or combinations of these. Total, 76 trials were included, covering a range of surgeries such as abdominal, orthopedic, thoracic, and cardiac procedures. The team used both inductive and deductive qualitative methods to analyze how prehabilitation was defined across these studies. By systematically coding and comparing the language used, they identified the most common elements and objectives of prehabilitation programs. This rigorous approach ensured that the proposed definition would reflect real-world practices and the priorities of both researchers and clinicians. After analyzing the data, the researchers proposed a consolidated definition for surgical prehabilitation. It is a process that begins at diagnosis and continues up to surgery, consisting of one or more preoperative interventions such as exercise, nutrition, psychological strategies, and respiratory training. Primary aim is to enhance a patient's functional capacity and physiological reserve, enabling them to better withstand the stress of surgery, improve postoperative outcomes, and facilitate recovery. Importantly, the review found that while medical optimization and general education are valuable, they are often considered part of standard surgical care rather than core elements of prehabilitation. This new definition is intended as a first step towards standardization, helping guide future research and clinical practice. The authors emphasize that ongoing collaboration among international stakeholders is needed to refine and globally adopt this definition. Establishing a common definition for surgical prehabilitation marks a significant milestone for both research and patient care. With a clearer understanding of what prehabilitation entails, future studies can be more consistent, making it easier to compare results and develop best practices. This in turn can lead to more effective interventions that truly help patients prepare for surgery and recover more quickly. However, the authors acknowledge that their definition is just a starting point. They call for further consultation with international experts, patients, and healthcare leaders to ensure the definition is comprehensive and widely accepted. As the field evolves, ongoing collaboration will be essential to refine prehabilitation strategies and maximize their benefits for patients worldwide.